From backyards in rural Appalachia to urban and suburban schoolyards, public health officials are warning of the rising tide of prescription painkiller addiction.
We've had an explosion of addiction to opioid painkillers.
Patients go cold turkey or wait in lines at methadone clinics to fight their disease, but many addiction specialists are turning to a newer drug, buprenorphine.
Buprenorphine is what we would call a partial agonist. And all that really means is that when buprenorphine interacts with the receptor, it only partially activates the receptor, as opposed to all of the other opioids you could think of, which when they hit an opioid receptor, you get full activation.
Its chemistry makes it hard to abuse and diminishes the chances of overdosing.
It's virtually impossible to overdose on buprenorphine itself. It's a partial agonist to the mu-opioid receptor, and therefore you don't get the respiratory depression that we see with full agonists like methadone or other opioids.
The luxury of buprenorphine is that it can be prescribed at any doctor's office. Patients can come here to their local pharmacy and have their prescriptions filled.
The great hope when buprenorphine was released and made available for the treatment of opioid addiction was that primary care doctors would begin prescribing it and that we would be able to dramatically expand access to treatment for people who are opioid addicted. Instead of telling everybody who's opioid addicted, you have to either get detoxed and stay clean or you have to go line up at a methadone maintenance clinic, now we really had an opportunity to offer treatment for people in a setting with privacy and with dignity.
But it's unclear whether that has been the case. This pharmacist in New Jersey says he hasn't seen more prescriptions for buprenorphine.
We didn't see as many prescriptions as it should, but it's out there for a physician to be able to prescribe it or learn more about it.
That's why some researchers are looking into a more creative means of getting the drug to those who need it. Bondina Stone is a nurse in rural West Virginia who is advocating for telemedicine. So you've seen a pretty bad drug problem in your area in West Virginia.
Yes, I've seen it, and it's growing daily.
And you yourself have had your own struggle with those drugs.
Absolutely. I became dependent after having a severe injury and during the course of recovery.
Buprenorphine is what helped you recover, correct?
Absolutely. It's the only thing.
Stone reached out to Koludny, who has signed up the help of a telemedicine prescriber in Arizona.
She has been prescribing buprenorphine in Arizona to people in different parts of the state who are opioid addicted. So the hope has been that through a telemedicine intervention, the physician in Arizona will be able to prescribe buprenorphine to patients in West Virginia.
That program is still in the works, and other barriers to wider distribution exist. Physicians have to take an 8-hour class to become licensed buprenorphine prescribers. Even then, they can only treat 100 patients. Also, some say primary care doctors are reluctant to see addicts in their practices.
They have these ideas that if they were to start treating opioid addiction, that their patients will be stealing things from their offices, that their practices will be disrupted, that addicts are bad people and I don't want them coming to me.
Stone says those perceptions couldn't be further from the truth.
There are children now addicted to this, and it's trickling down. And we have doctors and nurses addicted to it. It just seems everybody that crossed my paths, somewhere in their family there's an addiction.
She's hopeful that help will be just a computer screen and a little orange pill away. For MedPage Today, I'm Kristina Fiore.